I'm Dr. Joel Portnoy, ENT and voice and swallowing expert here at ENTA and Allergy Associates in Lake Success. I wanted to talk about in-office procedures. We live in a really exciting time. Technology is getting smaller and more portable. In fact, in the medical industry, we're taking things and procedures that previously could only be done in the operating room, and we're bringing them here to the examination chair. What that does is it benefits patients, doctors, and the healthcare industry alike. And in doing so, we're at the forefront of this technology. Here at ENTA and Allergy Associates, basically what we're doing is we're taking some of these laryngeal or voice box procedures and moving them here again. And so what I wanted to talk about, some of the things that we can do for our patients without having to take major time off from work and disrupting their lives. So whether it be an examination of the esophagus and the stomach via transnasal esophagoscopy, have the patient come in, no general anesthesia, and they go home the same day or back to work the same day. Or we can inject the vocal folds, plumping them up, making them nice and strong for a strong voice. Another thing that we can do is something called laser resection of masses here in the voice box. So previously what you want to do is you want to make sure you have a biopsy to confirm that you've got what you think you're dealing with. And that's also something we can do here in the exam chair. And then also, what we do is we can actually take a laser fiber, put through an endoscope, and put it down into the throat, and we can actually vaporize a lot of these growths that you see here along the voice box. This is a special kind of laser called a KTP laser. And KTP lasers use a special kind of energy to starve those growths of their blood supply without damaging the surrounding tissues. And in fact, what you see here is a patient who walked in, drove himself to the appointment. We numbed up his nose and throat, and we numbed up the laryngoscope so that we make sure that everything is nice and comfortable for him. And then at that point, we put this down here, a small fiber goes through, and what you'll see here in a moment is you'll see the red light turn on, and we're going to start to actually vaporize some of these growths here. And in doing so, the patient is completely comfortable during this time and doesn't experience any pain. Right afterwards, the patient then can drive himself home and drive him right back to his regular life, whether that be at work or at home or whatnot. So our job here at ENTA and Allergy Associates is to try to get our patients back to their normal lives as quickly and as safely as possible. I'm Dr. Joel Portnoy, voice and swallowing expert here at ENTA and Allergy Associates. Call us today, see us today, or go to www.entanallergy.com to book your appointment today.